Hi, I'm Kathy Peterson. Did you know that women who are going through menopause are impacted daily by unbearable symptoms? Some women are reluctant to go through hormone therapy because they don't know what the new guidelines, new perspectives, and new options are. Here to educate us on the current state of hormone therapy is Dr. Holly Thacker, director of the Women's Health Center at Cleveland Clinic Foundation. She's married and has 3 sons and has authored the empowering, entertaining, and educational book, Women's Health, Your Body, Your Hormones, Your Choices, a Cleveland Clinic Guide. Welcome, Dr. Thacker.
Hi, Kathy.
Let's go back a few years. Back in 2002, there were some contradictory reports about hormone therapy. What was that all about?
Well, I really think that the baby boomer generation of women should be hopping mad because they've really had their menopausal experience and options somewhat negatively altered by this preventive study. It was a very scientific study, but it was unscientifically interpreted.
Really?
It was a preventive study. It was not a menopausal study. And it was a study of much older women, and they couldn't even really have menopausal symptoms to get in. And so there were risks, although they're basically in the rare category, even for those older women without symptoms who don't even need treatment.
Yeah, and everybody has different symptoms and different issues with menopause. Some have extreme conditions, some of them have very, very minimal, right?
Yes, it can be very individual experience. And that's why I wrote my book, because I was so alarmed by otherwise smart and savvy women seeing otherwise good doctors being told stupid things about hormone therapy and the risk being exaggerated.
Yeah.
But one thing we did learn on a positive note is one size does not fit all. We do want to use lower doses if we can, and definitely individualized therapy.
That's very important.
Absolutely.
Because we all are different. We all have our own issues.
And one size does not fit all. And for hot flashes, which are kind of the hallmark of menopausal symptoms, we have a number of FDA-approved treatments. And I like to emphasize FDA-approved.
Okay.
Because what happened is when this news hit, women stopped their prescription therapies, but were still having horrible symptoms. So they had to turn somewhere. So where did they turn? They turned many times to unregulated groups that were offering compounded, mixed-up therapies, and they were being told, oh, no risk. Well, there's always a potential risk. So at midlife, it's a great time to kind of take stock of all of your symptoms, your family history, your personal history.
Right.
Now, one of the risks with hormone therapy that is definite is the risk of blood clot. But one way that we've been trying to get around that risk is there's been some recent research suggesting that the transdermals may have a lower risk of blood clot because they avoid going through the mouth and stomach and liver.
Okay.
And we do have some new therapies that can be individualized to different doses and applied to the skin.
Okay, so there are a lot of different options. Can you talk through us a little bit about that?
Well, we first had orals, then we moved into the patch, but a lot of times the patch doesn't stay on, or maybe it irritates the skin.
And especially in a humid area of the country.
Like Florida.
Yeah.
Yes, a lot of times it won't stay on. And so there's been gels. And the newest gel is Diva Gel. And it comes in little foil packages. And there's 3 different doses. So as a physician, that's what I like, because I might want to use a very low dose on a woman who's maybe older, over age 60, whereas a younger woman, maybe especially a woman who's had a hysterectomy or a woman who's having horrible hot flashes, I might want to start with a higher dose.
Right.
So it's nice to have different options. And it just comes in little foil packages that has the exact dose that you just apply on the skin, on the thigh.
Just rub it in?
Just a tiny bit, and it rubs in and dries within a minute.
Oh,
so
that's wonderful.
Kind of part of your beauty routine.
Very good. Very nice
We have
to know.
vaginal products. We have combination therapies. So certainly one size does not fit all. If you're a woman who's had a hysterectomy, we generally just use estrogen.
Okay. Let's talk a little bit about the risks and the benefits of hormone therapy.
Well, currently, estrogen is the only FDA-approved therapy to treat hot flashes.
Okay.
We've got some alternatives on the horizon, and certainly there's a small group of women who may not be able to take estrogen, and we have some options for those women. But all the other therapies, you know, a lot of women going into their doctor's office with horrible hot flashes, can't sleep, are written a prescription for antidepressants.
Oh, my goodness.
And I mean, antidepressants are fine medicines, and they do help depression, but
that's not the cure, is it?
If you're not depressed and you're having hot flashes and you can't sleep and you're having brain fog, I think it's an insult to be given a medicine that's not really treating the underlying symptoms.
Right.
And women should really educate themselves about what their options are, and they should really go in and see a practitioner that focuses on menopause and really has the latest updated information.
Right, and your book probably has a lot of that information in it.
And of course I've got to update it because we continue
probably every year,
new information. And so certainly there's some websites that women can go to.
Okay, can you tell us where we can go and find out more information about menopausal problems and hormonal therapy?
The North American Menopause Society, which is menopause.org, is an organization that's devoted totally to menopause, which is a natural life event. Okay. And it has lots of good health information, lots of different options, as well as a list of providers that are certified menopause practitioners.
Great.
At the Cleveland Clinic, our women's health website, clevelandclinic.org/women's health, is another great site for information. And information about this newest low-dose transdermal estrogen, Divigel.
Okay.
Their website is divigel.com.
Thank you, Dr. Thacker. It was great information and great talking to you.
Divigel is not for everyone. Patients who have had vaginal bleeding, certain cancers, blood clots, liver problems, stroke or heart attack, or are pregnant should not use estrogen. Estrogen may increase risk of uterine cancer, breast cancer, heart disease, heart attack, stroke, blood clot, or dementia, and should be used at the lowest possible dose for the shortest time based on treatment goals and risks. Common side effects include vaginal yeast infection, breast tenderness, and vaginal bleeding. Divigel is available only by prescription, so talk to your healthcare provider to see if Divigel is right for you. For more information on Divigel, call 1-800-654-2299 or visit www.divigelus.com.
Coming up, don't sacrifice taste for nutrition when picking up healthy lunch meat for your family. A heart-y suggestion is next.